My name is James McKenzie, and I actually live west of Boston, just outside of Boston, about 15 miles outside. And about a year ago, probably 2 years ago, I started having an issue being able to keep food down. Could not eat. Could not eat at all. Anything that I ate came right back up again. And with the exception of gourmet ice cream, that's about all I ate for about 6 months.
So Mr. McKenzie, in addition to being a fabulous guy, had a pretty advanced and aggressive tumor. He had what's called a poorly differentiated adenocarcinoma of the esophagus that involved the lower part of his esophagus and the top part of his stomach. In addition, he had lymph nodes in the area that looked like they were also involved as well. So he had a pretty advanced disease.
Molly Princevich, who's here at the Brigham as well, sent me to Dr. Janju, who did a endoscopy. And within a week, we had the results back from that. And I would say in a span of about maybe not even a week later, the aid team was put together. It started with Dr. Wee, Dr. Peter Ensinger, who works over at Dana-Farber, Dr. Harvey Mammon, who works here as well, and Dr. DeLuey, all put a plan together. And they're living proof why I'm here right now.
So Mr. McKenzie had a fairly advanced disease, so we kind of threw the kitchen sink at him, gave him fairly aggressive chemotherapy and radiation treatment. When he had a very good response, we followed that with surgery to make sure we clean out the entire tumor bed to decrease the chance of any recurrence of it coming back. In the course of his workup, because of his other risk factors, we did test out his heart, and that unfortunately, or fortunately, revealed that he had significant heart disease. We had a fairly long discussion with a cardiologist, and they felt that we could improve, or they could improve his cardiac status by intervening to a limited extent. That would allow us the opportunity to proceed on with surgery, and given that we were doing a robotic approach as a minimally invasive technique, we can try to minimize some of the trauma that goes with surgery in and of itself and try to decrease that overall risk.
I feel great. I absolutely feel great. Every day for me is a great day. There are some days when I don't feel so great. I'm a little bit tired, but it's to be expected, as I've been told probably a couple of years before I'll get back to maybe 85% of what I was. But I am 100% better than what I was a year ago before I had the surgery, for sure.
So I think the benefit of the place here is that we have a lot of expertise in a variety of fields, and specifically in this field as well. With our partnership with the Dana-Farber, we have oncologists as well as gastroenterologists that are familiar with this particular disease process. In addition, at least in our field, we see a large volume of esophageal cancer patients, so we have very good perspective on what the disease process is, as well as newer and innovative techniques that would help bring a complicated surgery in a more cohesive fashion that would reduce mortality risk and morbidity risk, and hopefully we can shepherd these patients through the process, even in a setting where there are actually medical conditions that would make surgery probably not available in a lot of situations.
Oh, no question. The professionalism of this hospital and the doctors that treated me, unbelievable. Plus the personal attention. It's not like you were actually talking to someone who was going through the motions. They were actually deeply involved. They were incredibly open to all of my questions and all of my needs.